Hi everyone, good morning, good afternoon, good evening, depending the time you're coming across this video. Still your favorite girl, Nurse Precious, and today we are going to be talking about prevention and then treatment of bacterial infection, just as I promised. So please if today is the first time you're coming across my videos, please do well to like, comment, share, and follow for more of these health talks. So what is the treatment of bacterial infection? Treatment of bacterial infection focuses mainly on eliminating and then managing the symptoms. The most effective or the most common and effective method of treating a bacterial infection is with the use of antibiotics. Though supportive care and then preventive measures play a vital role in treatment of bacterial infection. So number one here on my list, I'm going to talk about the use of antibiotics. So what are these antibiotics? So antibiotics are drugs that kills bacteria or inhibit their growth. Yes, they are prescribed based on the type and the severity of the infection. So important thing to note on the use of antibiotics is that antibiotics do not work against viruses. Number two is that is misuse. Example of misuse is you not completing the full course or you using without prescription. It can lead to antibiotics resistance, which is a global health threat. Yes, antibiotics resistance is a global health threat, which we are trying to create awareness and trying to tell people about it for us not to misuse antibiotics. Another point to note is that some infections may require intravenous treatment. Yes, so in that case, you see that you need to consult a healthcare practitioner to do what? To help you in this case. So another thing, number two method or number two treatment of bacterial infection is culture and the sensitivity testing rather. Culture and sensitivity testing. So before prescribing antibiotics, doctors may collect samples of either your blood, your urine, or your sputum. To number one, to identify the specific bacteria, which is culture test. Number two, to test which antibiotics the bacteria are sensitive or resistant to. That is the sensitivity test. So this ensures accuracy or targeted treatment. So it's very, very important that before, if you notice or if you have any signs of bacterial infection, if you just notice any sign at all, do not indulge in any kind of self-treatment. Do not indulge in any kind of self-medication. Seek a professional help. Go and see a doctor. Go to lab, test yourself, and know the kind of infection you're treating. Because if you don't indulge, if you don't go through this testing, you might end up buying antibiotics that the bacteria in your body is resistant to. So that is why it is very, very important to do what? To go and seek professional help each time you experience or you have any sign of bacterial infection. So having talked about the treatment of bacterial infection, I would like to tell us the prevention of bacterial infection. What you need to do to prevent bacterial infection. Because preventing bacterial infection is often easier, and safer than treating them. So number one thing to do prevent bacterial infection is personal hygiene. Yes, personal hygiene. How do you practice personal hygiene? Number one, hand washing. Hand washing with soap and then water regularly, especially before eating and afterwards using the toilet. Always ensure that you wash you wash your hands with clean water and soap. Another way of practicing personal hygiene is what? Oral hygiene. Oral hygiene, brushing and then flossing your teeth. It helps to prevent gum and then dental infection. Another thing is avoid sharing personal items like razor, shaving beak, towels, and etc. A lot of them. There are some items that are so personal that you don't need to share with someone. So another thing to do to prevent bacterial infection is what? Food and water safety. Yes. Cook your food thoroughly and then store them properly. Drink clean and safe water. Some waters are not safe for us, especially there are some people that once they drink rainfall water. So this kind of people now, there are some kind of people that once they drink rainfall water, it starts reacting on their body. So that's why I said you should drink clean water and then save water too. Another thing is that always make sure you wash your fruits and your vegetables before eating them. It's very, very important. And avoid street food, especially those that are being sold or being cooked in unhygienic conditions. Because most of this street food, we don't know the place they are being cooked. We don't know how hygiene the person that prepared the food is. So it's very, very important that you prepare your meals yourself. In that way, you know how you prepare them and then before consumption. So number three preventive measures of bacterial infection is environmental sanitation. Yes, environmental sanitation, which is proper waste disposal and toilet hygiene. Yes, clean surroundings. It reduces the spread of what's it called? Waste, water and soil-borne bacterials. Yes, once your surroundings are clean, it helps to spread. It reduces the spread of water and soil-borne bacterials. So number four, preventive measures of bacterial infection is vaccination. Yes, some bacterial infections can be prevented through vaccines. Example is BCG. BCG for tuberculosis. Number two is what's it called? Pneumococcal, yes, pneumococcal vaccine, which prevents pneumonia and meningitis. Yes. Another thing is tetanus vaccines. Another vaccine is tetanus vaccine, and the other one is typhoid vaccines. So these vaccines mentioned are especially important to children, the elderly, and those with those with weakened immune system. Yes. So this kind of people now, they are the ones that need vaccinations. So another preventive measure, which is number 5 now, is safe sexual practices. Yes, safe sexual practices. Use of condoms and regular testing can actually helps to prevent sexual transmitted disease, sexual transmitted bacterial infections, such as gonorrhea, respiratory what's it called? Not respiratory, such as gonorrhea, syphilis, yes, syphilis, and let me say chlamydia infection, bacterials. So all these and so the number 5 preventive measures of bacterial infection is responsible antibiotics use. Only use antibiotics when it's being prescribed by a healthcare practitioner, by a healthcare professional, let me say. Always use antibiotics when it's being prescribed by a healthcare professional. Do not indulge in self-medication. Another thing, always make sure that you complete the full course. Whenever you're being given an antibiotics for a specific treatment, always make sure that you use them finish. Use the full antibiotics being given to you to avoid antibiotics resistance. Always make sure that you do what? You use it. You use the complete course. Another thing, never use share or use leftover antibiotics. Never use share or use leftover antibiotics. So in conclusion, bacterial infections, they range from mild to life-threatening. But with proper treatments and preventive measures, most can be managed effectively. Yes. The key lies in early detection, appropriate antibiotics use, good hygiene, safe practices, and vaccinations. So public awareness and then global actions are also vital in fighting antibiotics resistance and reduces the burden of antibacterial disease worldwide. So I encourage us and I plead with us to always seek professional help whenever you notice any kind or any sign of infection. Do not practice self-medication. And please help share these videos. By sharing this video, you're creating awareness. You're telling people out there, because there are a lot of people out there who doesn't know that not finishing a full course of antibiotics being given to you might actually cause antibiotics resistance. Yes, because when you're being given, let's assume that you're being given a particular antibiotics to treat one particular infection, and you then take half of it, you felt okay, you're feeling better, and then you didn't finish it. When that infection will come back again, it will come back with full force, and at that point, that particular antibiotics might not work for that infection again. Why? Because the body have grown resistance to that particular antibiotics. So when you share this video, someone out there who doesn't know about this will get to learn this, and always try to practice safe sex. Is very, very important. Always try to practice safe sex. So without wasting much time, we've come to the end of today's class. Please help me to share this video, like, comment, and then follow and subscribe to my channels to get more of these health talks. Thank you, and then see you guys in my next video. Bye.